Welcome back to the show. This is a new update to the In the Clinic with Rob. Yes, we are back. It's been maybe a month. I think it's maybe been a month since we've had the full In the Clinic with Rob podcast. A lot to talk about today. A lot of good content. I'm also adding a stream to this video now. That's coming aboard as well, so we get a little behind the scenes with me in the headgear, with me in the crow's nest up here. You might see my dog running around and eating different stuff that he finds on the ground. But overall, pumped to be back. A lot to share, lot to talk about, dig into. So let's fire away and get started. One of the things I like about this podcast is it allows me to really get out, some of the great things that are in my life, from my family to the office to now coaching, it's nice that I'm able to express some of that because one, it sheds light on them. I mean, there's a lot of great people that are in my life, and it's nice to be able to express to them how I feel and let them listen out loud to know what my thoughts are, other than just me telling them in passing. And this week has been this past week has been an interesting week because I've gone from helping my daughter with continuing to advance in her basketball skills. She's all in on becoming the best basketball player that she can, while she's starting softball. So my wife and I coach varsity softball, and with coaching varsity softball, it's a task as well. I mean, that's a whole nother area. And, a lot of this we get ran into. We get a lot of things that are involved in our lives that really take up all of our energy and our thoughts. And then something happens and it kind of all just settles. And it all just kind of slows down. And it makes us look at things a little bit differently. And that happened this last Monday when my dog's brother, so littermates, Kenai, passed away. Now he was coming on to 14. I think he was almost 14 this April, and he passed away, and he slowly was losing all of his ability to move, put weight on his legs. He has lost so much weight because he wasn't eating really, and it was just sad to slowly see him, kind of wither away in a way. It was tough, and so it gives me something to reflect on. I have an article for the newspaper coming up that's talking about the differences that I've seen just in aging from watching my two dogs. So I have a young pup, Blue, that's 4 months now, and then I have my older dog, Finn, who's almost 14. That, like I said, was Kenai's littermate. And it's challenging to see these two. It's challenging to see my dog Finn that has lost some of his mind, not just the physical limitations where he can't walk as well, he can't jump, he can't get up and off the bed as easy. I mean, he's just a slow mover, and he's really just a shell of his former self. And then you look at Blue, who's running around, jumping up and down, just wasting every bit of energy that he can because he has so much it just wants to pour out of him. So all in all, it's interesting to see these two individuals, two different dogs, different times in their life, and just how it impacts us. But that was a moment this last week that just maybe gave me pause, reflection, and it's hard to see the change. And I think that's the hard part in life, is to see the change that always occurs. Nothing ever stays the same. We at the time when we're 5, 6, 7, 8, 9, 10, 11, 12, we want to just stay at that age forever, and we can't picture ourselves growing up. We leave from high school, and we start making a path on our own, and it's a hard challenge at that time to accept the fact that it's time to grow up and to start advancing in your own life. And then we continue and we progress in our life, whether that be in work, marriage, children, and everything creates a new wrinkle. It's always change. And again, the blessing that I have in my life to grow to 42 is that, the gift that you get out of living longer is that you get to know death more, from the family members around you that pass on, to your animals that pass on, to friends that pass on. And it's interesting, as your life continues to advance, and you see that you become more accustomed to death, really. And I think it gives you perspective overall in the life cycle, and where you're at, and appreciate what you do have in front of you. And so again, it gives me great appreciation for the time that I have with my dog Finn, now that Key and I passed on, as well as Blue, and to appreciate them both. So, all in all, this week has been interesting in that capacity. From softball, gosh, we've been ramping up in softball, and this was our first week in softball as well, to where girls are getting used to us again. My wife and I coach together, and we are a pair. And being a pair, we have different styles that blend together, but also are opposing as well. So we're an interesting duo together, but we completely complete each other on what we're trying to do. So that's been good. I'll get to more of that in a minute. Other little tidbits, we're looking at, my dog Blue. Gosh, he's goofy. He's 4 months old. He's scared of everything. He's down there doing his business at the bottom part of my steps down here, and I'm watching him, and he's just enjoying himself, letting it all happen. And all of a sudden, geese fly up overhead and just start honking aggressively. He looks up and sees these, and just sprints up the stairs as quick as he can, runs back into the office, runs under my desk, and just hops in his little dog bed there and hides. So, he's I don't know if he'll make it as a bird dog. He's a chocolate lab. That's hopefully a goal, but we'll see. He's got to get over hearing the honkers and getting scared. Other note in the office, the clinics, providers are doing a great job. Front office is doing a great job. It's interesting because we're putting a lot of time into training. We're putting a lot of time in each group, our front office, to our providers, our assistants, across the board. We're consistently putting more time in, and that's just paying off. It pays off in the execution that we're doing with our clients. It pays off in the minute that you call our office and we answer the phone, to the point where you get scheduled, to where you start your first evaluation. I mean, just all the way down to when you get discharged and possibly start our training program next door. So it's a well-oiled machine that we keep getting more efficient. We keep refining what we're doing. We keep looking for ways to add value. And that kind of dovetails into March. And with March, we'd like to do some type of a campaign each month that just gives us purpose. It gives us purpose to get excited for different things. It gives us a way to get outside of the normalcy of life, where we kind of do the same thing over and over. And it gives us something to look forward to. So, this month, we have 2 different campaigns. One is March Madness. So every year we do a March Madness tournament. We do a buy-in. As far as is zero. There is no buy-in to get into our tournament. So it's not a gambling event for us. I just give away money. So we're going to have a tournament this year. This time I increased it to $200. So if you're looking to join our March Madness pool, you can certainly do that. I have it updated on Facebook on how to enter there. And some of you that get my weekly emails, you're going to get an email that talks about our pool. But we wanted to get out there early. The tournament's not going to be until I think the 3rd week in March. But we wanted to get out there early so that people can go ahead and get on our radar that they want to be a part of that group. So as soon as that tournament is closed and all the teams are officially in the tournament, then we can quickly turn around, send our link to everybody, and they can sign up for their teams and execute that well. So we should have a really good turnout for people that are looking to be a part of our March Madness pool. The other thing that we're doing this month is employee wellness. And, us as physical therapist providers, we're no different than anyone else. And what I mean by that is we all have our own wellness needs. We have our own areas that we need to improve on in our lives. And I'll give you an example that with me playing more basketball with my daughter and preparing in playing more full court basketball, pickup basketball, I've developed some right leg Achilles tendonitis. And with that, I've tried to nurse through it. I've tried taping a little bit, and I haven't put my full dedication into it. So I got my guys, Ryan, I got my guy, Tyler, both that are going to start working on that Achilles, keeping me accountable to taking care of the things that I need to make that Achilles recover properly so I can return to basketball as much as I want. So that's for me. We have different individuals in the clinic too. Like Tyler, I just mentioned, is looking to train for a strongman. So he wants to increase his overall potential, and he's currently training in the gym to improve his strength for a strongman competition. So he's looking to attack that for this month. Ryan has mentioned that he has some light upper trap pain at times, and he wants to get on a program that starts taking care of that from the scapular muscles all the way up to the cervical spine. So that's a goal for him, is to attack those. Carrie in her office, who's a physical therapist assistant, she's mentioned multiple times she's got a little bit of foot pain there. That's irritating her. Nessa would like to assist with her scapular region as well, similar to Ryan's. There's a little dysfunction there. Mackenzie, our office manager, Mackenzie recently joined our virtual personal training program. And since she joined our program, she'd like to improve her overall fitness, her overall wellness. So we're excited to have her a part of that. As our employees are just the same as everybody else. We all need to improve our fitness and wellness. So she's being proactive in it. She's joined our team. She's a part of our group to where we're going to keep her accountable, help progress her in our virtual personal training program from her goals, her programming, and give her all the support and accountability she needs. So we're excited to have her a part of that. We do have a couple other people that are looking to join the bandwagon of the employee wellness. One of them's Emily. Emily is looking to do a half marathon. So there's training that involves in that. She's excited that the weather is starting to melt off. She can do a little bit of running outside instead of only being able to run on the treadmill. So all in all, we've got a lot of different providers that are looking to take advantage of the employee wellness. They've put out there, like myself, hey, I've got an Achilles issue. That's now for us to keep each other accountable and to start marking our progress on how we're doing with that. So this month, expect me to, whether it be on the podcast, whether it be on YouTube, Instagram, Facebook, a lot of our different social channels, we'll be talking about our providers and what they're doing and how they're looking to improve their wellness overall. So look forward to that. The other thing we're doing is this is the only time all year that we're going to give this discount. We are giving a massive discount for our virtual personal training program. So this is a program that is all encompassing, that we absolutely take care of you from beginning to end. It's a full year program that you get us as your personal trainers, and we call it virtual because we can virtually do it anywhere. It can be done in our office, it could be done at a different gym that you go to, it could be done only at home. So it can be done virtually anywhere, and it's really about meeting you where you're at in your life. And for us, I've talked about this in the past, but this is something that allows us to help hold people accountable, give them the proper progression that they need. And we're all healthcare professionals, which can take care of any type of the injuries that you're having that you currently have or might develop through your training. So overall, we're giving our employee discount. So this is a 25% discount on our virtual personal training program, which is over $500 off our premier program. Again, this is the only time this year that we're going to do it. We will not do another discount like this all year. And on top of it, we're limited to only the first 5 people. So the first 5 people, if you're listening to this podcast and you're hearing that and you're interested, you jump on it now, because the first 5 and then we're closing the door on it. And that's the only time this year that we're going to be giving that discount. So again, the virtual personal training, it's out there. Take advantage of it. If you're on the fence about it, this is your time. This is your time to jump on it. It's a perfect time with the weather changing, perfect time with the change of the season. You can get outside. It's a great time to kickstart your fitness. You're through a lot of the holidays, and you deserve it. So take advantage of the discount that we're offering, and reach out to us today. So switching gears just a little bit, I got a couple stories that I want to share with you real quick that have to do with our softball team, because some of the girls know us really well, and some of the girls have just started to learn that, one, I'm a little goofy. I like to have fun. I can be serious, but I do like to have fun. So I was telling them a story about the first time I went to a concert, and my wife and I were blessed to get tickets from her sister to the Mcgraw Faith Hill Soul to Soul tour. And this is like early 2000. This is their first tour that they had. They came to Spokane. They were at the Spokane Arena. And we ended up having tickets down on the floor. And we show up. The first act is already going. It's dark in there. It's loud. And we can't find our seats anywhere. We're constantly looking for our seats. We can't find them anywhere. And finally, we ask an usher, where's our seats? And the usher makes a little call on his radio headset, and it says, follow me. And he takes us off the floor, up the stairs, and we're going, geez, we're not on the floor anymore, bummer. And he takes us up, and he ends up telling us that they had to move our seats because of speakers. They needed more room for speakers. So they take us out, they take us all the way up front, and they position us right up front, right next to the stage. We're within 5 feet of the stage, and the stage is elevated, so it comes up. So we're looking at the stage. It's right above us. So we're thinking, these are sweet. These are awesome. These are perfect. Well, Faith Hill ends up coming out. And, Faith Hill, especially in the 2000s, she was big time. Just big time. She was at the top of her game. Everybody knew who she was. She had huge hits. She was it. And she ends up coming out and walks over to the side where we're sitting, and she stands right in front of us. I'm within 5 feet away. I mean, I could almost touch her. She's so close. And she's wearing this black, like leather pant bottom, a black leather top, crop top, and only her belly's showing. and I'm sitting there with my wife, who is my girlfriend at the time, and I am so starstruck by this. And I'm going, I've never even seen a celebrity before. And I've seen Faith Hill on the country music shows, everything so much, that the only thing I can say is, wow. Wow. Oh, wow. Wow. After about the fourth wow, I feel the slug across my chest, and I look down, and it's my wife's arm pounding me in the chest, and I look at her, and she goes, I'm right here. and I think this was the insult to her is the fact that my mouth was so far down and wide open that I think my response to Faith Hill standing in front of me wasn't appropriate. But she got even with me. She definitely got even, because Tim Mcgraw came out in his black tank top with his ripped jeans, his tight ripped jeans, his cowboy boots, his classic black cowboy hat, and he's out there doing Indian Outlaw, shaking it, and all I heard from her was, wow. So all in all, it was a great experience. But we ended up. I told that story at softball because one of the girls had on a Tim Mcgraw T-shirt, and I'm thinking, wait a minute, you don't even know who Tim is. I mean, I can't even believe you even listen to his music. He hasn't really thrown big hits out there in a while. So, but I was impressed. She knew who he was. He liked his music, and so I was pumped that she had the Tim Mcgraw T-shirt on. Other little note about softball, it's a joy for us to coach. Part of the joy of coaching is the fact that we get to help individuals. We get to help change lives. And, every year I know the amount of energy it takes to coach, from organization to preparation, equipment. Like right now, we've got snow everywhere. So are we going to be outside on the field? Are we going to have the field ready? Are we going to have the gym ready? If we have the gym, we have to share it. What time is our gym going to be, early, late? It's just, there's a lot. There's a lot that goes to coaching, and we haven't even talked about, instruction, wins and losses, or parents or player expectations. So it can be overwhelming to start the season because you're at day one. But there's nothing like it for me that when you get into the gym and you get in front of all those eyeballs and you start to realize the impact that you get to make on young people. And I forget it because it triggers me through instruction, the different insecurities that people will have as you're coaching. And as this comes out, you can empathize with where they're at mentally. And, it's a great lesson for me because I can share my knowledge that I've gained over the years in just psychology, in counseling, of working with athletes and knowing exactly what they're going through. I can empathize at such a level that allows them to have improvements in their life now. And I think that's the biggest beauty of being a coach, is that for the coaches that truly love it, dedicate themselves, and are there for the players, it's so powerful. It's so powerful. You get to make the ultimate difference in their lives. Your parents overall can only reach you so far. And a coach themselves can truly push a player into an area that a parent can't. It's like me trying to work on family as far as a physical therapist. They see me as Rob, as, uncle, as, cousin, brother. They don't listen to me the same way as provider Rob, as somebody else that doesn't know me. And that's the same. It's harder to push your kids into areas that they might not be comfortable because they see you as dad. Dad, why are you doing this? Hey. Whereas coach can be firmer, can be push them in the areas, but also coaches can be mentors in a way that parents can't. You just form a different relationship with them, but you're still part of their growth network. So, I'd have to say that coaching truly is a blessing. The way that you can impact lives, you get to change lives, the challenge that you have, the sharing of joy that you get with your athletes, it's just unparalleled. It truly is. It's something that I can see myself continuing to do at some capacity throughout my life, solely because it's there that to give to other people and help them in their lives. I mean, it's worth so much more than money. It really is. It's that gratification that you get on helping somebody else and make a difference in their life and see the light bulb go on when you talk to them in a way that nobody has ever talked to them. Powerful. Absolutely powerful. So, all in all, I'll keep sharing some of the things I tell my athletes so that you can spread it on to your kids, onto your siblings, onto maybe your players, because it's powerful. So, that's a extended intro that I got there. But when we come back, we're gonna switch gears, and I'm gonna talk about MRIs, and I'm gonna get into MRIs and truly why the MRI is overrated. Let's just be frank with it. The MRI is overrated. So when I return, I'll elaborate why the MRI is not just overrated, it's grossly overrated. All right. Thanks, team. And we're back from the break. And yeah, sure enjoy coaching. I sure enjoy, a lot of the different things in my life, from the clinic to my family to our new little pup. All in all, things are pretty good. I'd have to say, the best way I like to tell our young athletes too, and at times my own kids, when you're truly disappointed, you're upset about something, just changing your perspective can help. And when you really push against the narrative that I'm upset about something, just look around you. It'd be tough being in Ukraine right now. I mean, you look at that changes the game for you. When you could say it's nice that I'm not in Ukraine and worried about being bombed right now, that changes your perspective. So, at times when you're disappointed, change your vantage point. Change what you're looking at. Look at it from a different angle. If you took that concern and put it on the ground and looked at it on top of a table, a building, sitting on the floor, sitting in a chair, with glasses on, without, it's going to give you a different vantage point. So all in all, what you really want is perspective, and when we have perspective, it truly allows us to enjoy our lives. It really does. And that's, a lot of what we're looking for. So for me, I'm looking to get our athletes, our players, to truly look at their lives through different lens, different prism. And that doesn't mean optimism. Optimism gets a bad rap. You'll hear this toxic optimism and stuff. What it really is pragmatic optimism. That's what it is. It's pragmatic optimism. I can't say, well, I'm optimistic that I'm going to be in the NBA by next year. Come on, Rob. You're 42 and you're not that athletic. Well, no matter how optimistic I am, it ain't happening. But pragmatic optimism is needed. Being pragmatic about your optimism and saying, hey, I'm upset about this. That's okay. But if I really put it in a box and look at it a different way, my life's still really good. So part of me that helps me tick and helps me keep moving is the fact that I have the ability to separate those. That's just me. And I try and teach that to my players at a young age, that you control your happiness. You control it. You control your life. You control your circumstances. And a lot of times it's just a matter of how you look at it. And it's not because everything goes your way. Even some of your greatest failures could be seen in an optimistic way that's helped you in your life. So switching gears, I mentioned before the break that we're talking about MRIs. And I mentioned that MRIs are overrated. They're overrated. And the thing for me is I really enjoy the clinical setting. I like the outpatient arena. The joy for me is meeting new people, helping long-term patients, even just joking around with my colleagues or my patients. It just makes it enjoyable. But my favorite part of the job is really the unknown. I like treating patients, especially the evaluation, because I'll see an individual with a neck dysfunction, a knee dysfunction, a shoulder dysfunction, ankle, back, vertigo, whatever. Whatever it is throughout the day, I don't know. And I can never predict what's coming down the line or what kind of lifestyle that they have. Everything's so different. It's just so unknown. And that's the fun part for me. I like, in my little way, I'm a detective. I'm Detective Rob. And I get to test all of my different theories on why a patient has a particular problem with the special tests that I know, different interventions that I can apply, and really at a minimum, trial and error. But for me, overall, I like the unpredictability and my ability to create some order from the madness. I want to take the unknown or the irrational and break it down from the biomechanical, the lifestyle, and bring light to that and create logical reason of why people are having certain dysfunction in their life, pain problems, or other. So for me, the reason I bring this up is because I get a lot of different patients that will come in with a preconceived notion. They have what I call an unconfirmed bias. They have an unconfirmed belief already before they even start their physical therapy. And a lot of times they might have this unconfirmed belief because they don't know any better. They don't even know. And what they're going by is solely what they've been either told or from an unconfirmed bias of where they think they're end up going to be heading. So I get patients from time to time that will say, you know what, I'm here because I really need X amount of physical therapy visits because my insurance isn't going to pay for my MRI unless I do physical therapy. So this leads to frustration for the patient because they are fully obsessed or transfixed on the fact that they cannot get better in their dysfunction without an MRI. They can't get quote unquote fixed without an MRI. So their full focus is just that I need this MRI and I'm only here sitting in front of you because you're a means to an end, not because you can help me. So that's a challenge. That's a challenge for me because, one, there are individuals that are upset because they can't get an MRI. My insurance should pay for it. The other side is they don't understand that we can actually help them. So let me explain just a little bit that the reason that insurances have gone away from blanketly giving MRIs, because the expense of an MRI is between $2,500 to $4,000 per scan. And the overall prevalence of use of MRIs over the years has greatly increased. MRIs do demonstrate images of muscle, bone, connective tissue, but the clinical exam will find just about as much as what the MRI will find. Specific patterns do exist, and you combine with different dysfunctions. And when you combine that with the disorder's presentation, this really allows the provider to get the full picture and the understanding of what's really happening without even a need to have the MRI. I mean, for me particularly, most patients I treat, I can determine whether they have what type of shoulder, knee, back, or hip disorder that they have without even having an X-ray or MRI, solely because of the patterns that they're demonstrating. Now, I'm not saying that MRIs aren't necessary. What I'm saying is that the prevalence, that the absolute need is not always necessary. So let me give you a couple examples why. I got 3 examples why an MRI truly isn't needed, and this is backed by science, really. In 2019, researchers used 230 asymptomatic individuals. That means individuals that have no pain, and they performed a knee MRI on these individuals. The results demonstrated that 97% of those individuals that have never had pain in their knee, 97% had meniscal tears. So 97% had some level of knee abnormality that you could look at and say, ooh, that's a problem. But let me correct that. 97% had a knee abnormality. 30% were meniscal tears, but they've never had pain in their knee. But wait a minute. If they had a tear and the tissue was damaged, why didn't they have pain? And I hear this from my patients often. I have a tear to my meniscus, and surgery is the only way to make it better. But this study pokes a big hole in the MRI bias. All of the individuals in the study had no pain in the knee. How can this be? This study is just one example allowing us to question the effectiveness of using an MRI as the primary determinant of a dysfunction, a musculoskeletal dysfunction. But number 2, so we've gone through number 1. Number 2, in 2015, researchers took a meta-analysis. So this is where they take a whole bunch of studies. So not just one study. They take a whole bunch of studies that are very, very similar, and they combine them together. And they determined after these 33 randomized control studies, they determined that the prevalence of back dysfunction in people that have no back pain. They found similar results as the knee study that I just talked about. And they determined that 37% of 20-year-olds had some back dysfunction from their MRI, and that increased to 96% of 80-year-olds. But they had no pain. What does this mean? How can this be possible? How can people with an MRI that demonstrates a disc bulge, degeneration, spinal stenosis, not have any symptoms or any pain? How can that be? The MRI shows it. They should have pain. Let me give you a third example. But what about needing an MRI for surgery? You know, a lot of times you hear, well, I'm going to have surgery, so I have to have an MRI. They took a look at a study on rotator cuff tears from 2019. They took all the patients suspected of a rotator cuff tear and performed an MRI to just determine the severity of the rotator cuff tear. From the study of 51 individuals, 96% did not have surgery on the rotator cuff, but continued with conservative care only. So the vast majority of people who received an MRI never even had surgery at all. So what was the point of the MRI? So let me back this up a little bit. I've given you 3 different studies there. Let me back it up just a little bit and let's unravel it, okay? From these articles, we can see that an MRI can find dysfunction in the knee, back, shoulder. But this is not the predictor of pain or a successful outcome. If we can have an apparent dysfunction but no pain, we must question using an MRI when we do have pain. So if we do an MRI and find that people that have never had pain in their knee, back, or shoulder before in their lives, and it shows a particular dysfunction that would warrant a surgery, but they don't have any pain, then we must question the inverse, which is if you actually do have pain and an MRI shows a tear, how do we know it truly is the tear that's causing the problem that requires surgery? Now, here's the other thing. I haven't even touched on the results of research articles demonstrating the false positives of MRI. I mean, an MRI truly is just an interpretation. And many times the understanding of the image is not consistent with the reality of the person's situation. So, for example, the radiologist reading the original report and the patient's orthopedic surgeon who might be doing the surgery that looks at MRIs all day, they don't always agree on their quote-unquote interpretation of the image. You might have the radiologist saying there's no tear here and the orthopedic say there's a tear. But if an MRI is so definitive, why don't they always get it right all the time? Why isn't there always agreement? And that's because an MRI still is interpretation. It's like taking a photograph of your friend and telling somebody, tell me what they're thinking just by looking at the photograph. You can make assumptions. You can say, well, you know what? It looks like they're smiling. They're probably thinking about something happy. You can assume, but you cannot definitively decide what that person's thinking just by the picture. Same thing with an MRI. Only looking at an MRI to make the clinical decision of a patient is stupid. Is dumb. An MRI should be there only to help confirm what you need to know. It's a tool. It's another tool. It doesn't help make you better. Let me elaborate more. So, you can have individuals that have a pre-surgical diagnosis from the MRI that says they have a mild tear to the rotator cuff. They go in and do surgery, and it's a massive tear. You can go and say, nope, there is no ACL tear. It's intact on the MRI. And they go in and do surgery to do a different type of surgery just to clean things up, and they find a tear to the ACL. Again, this is just an interpretation, which truly makes the MRI just overrated. It is overrated. It is not the definitive answer that helps determine whether or not you are going to get better or not. Now, don't get me wrong. An MRI is necessary, and it has purpose, but it's a roadblock for the patient truly receiving the care that they need. Patients will become fixated on the need for an MRI. They will believe it's the only way to quote-unquote find out what's wrong with them. And at times they become obsessive regarding the image results. They'll come in and say, see, it says right here that I have a tear. I have a torn meniscus. I have a torn labrum. I have a rotator cuff tear. And after this MRI report, they can become super fixated on the results. It says degenerative joint disease. It says arthritis. It says it's a tear. But what does the research articles truly explain? It doesn't matter. You can have all of these dysfunctions, have no pain, and not need any surgery, and be just fine. That should be comforting, not fearful. You can have a tear or arthritis and still be just fine or better. Be pain-free and have full function. That's comforting. And our patients need to know that. You do not need an MRI to get better. You don't. An MRI helps confirm a suspected diagnosis. It's not a treatment. It's an interpretation, not an answer. So who should get an MRI? When should we get an MRI? Well, yeah, MRIs do have a purpose. But the goal needs to be in assisting in the clinical decision making. So let me give you an example. Suppose a patient has a non-functioning shoulder. They had a recent fall and a suspected detached biceps tendon repair. Well, in that case, an MRI is used to confirm a rupture to expedite the surgery. An MRI is also excellent for a patient's differential diagnosis who does not respond correctly to conservative care. So in these two examples, an MRI is warranted. In one example, you had a recent injury that when I'm doing my clinical test, you're not getting that biceps to fire. It appears to be that it's completely ruptured. You need to get that pinned back down soon, or else it's going to shrivel up and you're going to lose it. Necessary. Hey, I'm suspecting that you have this dysfunction to your knee. We've been working on it for the last 2 weeks, and it's actually been getting worse. That is not typical. It should not happen. We should get an MRI at this point to confirm that there's no differential diagnosis. That's perfect. It's perfect. So as I kind of explained at the beginning of this MRI talk, I love working with patients and I love assisting to the road to recovery. I love that. The obsession or the bias towards an MRI has led patients to delay their care or not make the most of their conservative care treatments. The MRI does not assist in the healing process. It's not an intervention. It's just a picture. It cannot explain how someone feels, moves, interacts at work, or how their dysfunction limits their lives. My goal is to help people improve their lives and to get the most out of their day. Looking for an MRI to fix their pain, their movement, or their limitations in life truly only delays our treatment and wastes an opportunity to improve right now. If you feel that you need an MRI to get better, you should discuss this with your provider. A rationale will conclude your specific dysfunction with imaging studies to guide an effective plan of care. Sometimes an MRI is needed to help guide that care. It is. But often, it's not. Often it is not. I want to see you get the absolute most out of your care. And when we have in our mind that the only way that we can get better is we have to have an MRI and get surgery, it grossly limits our ability to get better today. MRIs, yep, they're overrated. They're overused. They're overutilized. If I was an insurance company, I'd do the same thing. Take your time and energy to commit to getting better now without having to have the surgery. Without having that on your mind, because you know what? Another story for another day. Surgeries aren't perfect either. All right. When we return, I'm going to fire back up. I'm going to talk a little bit about patellofemoral pain. Patellofemoral pain, what the heck is that? PFP. And then we'll finish up for the day. All right, team. When we return, PFP, patellofemoral pain. And we're back to the show. Yep, had a good segment there on MRIs. Yeah, they're overrated. Yep, you should know them by now. You listen to that segment, you'll believe it. MRIs are overrated. Save your $3,500 and just go to Costco and load up on new furniture and a whole bunch of groceries. So, yep, just save it. Save your deductible. But no, switching gears, let's talk about patellofemoral pain. So, holy smokes, that sounds like a whole mouthful, patellofemoral pain. But it truly just is knee pain around the kneecap. I mean, that's about as sexy as it gets, kneecap pain. But what it really is tenderness that happens around that kneecap. And we see it, especially in active individuals. So if you like running, they also call this runner's knee. It's something that occurs from repetitive, usually weight-bearing activity, running, squatting, those type of things that you're doing repeatedly over and over and over, it comes out. And you'll see it in sports. I see it every year when we start doing softball in the gym. We start doing, basketball at the beginning of basketball season, and they get in the gym and they start doing a whole bunch of running. What you're really seeing is the development of some of the knee pain there. So patellofemoral pain is pretty easy to determine because around the kneecap itself gets tender. It gets really tender around that kneecap. And when it's tender, that's usually a sign that you have some level of patellofemoral pain. Now, it should be noted that as soon as you start to get this, you need to switch up your training errors. So if you're doing a whole bunch of running, you need to decrease it. If you're running on a dome surface or a cantilevered surface where one side's, one leg's lower than the other, that can create some of that leg length issue with your running. If you're using poor shoes, unsupportive shoes, that can create some of your patellofemoral pain. So the key is identify why you're getting it. Is it related to your training, your dysfunction? But overall, start decreasing your exacerbating factors. If you're getting it from running, decrease your running. If you're getting it from basketball, decrease your basketball. But you got to jump on this first because you don't want to get to a point where it starts grinding and it hurts at night just to sleep. If it only hurts during activity, that's usually your first sign. Okay? Definitely ice. Ice is something that you can utilize to help decrease irritation when it first happens. But the other thing that we might do for you, if we saw you in the clinic, is taping. And there's a couple different tapes that we can use. One would be a restrictive tape, like a McConnell or a Leucal tape. And we'd use this to offload the kneecap. So if the kneecap is in an orientation that's causing irritation on the one side, we could offload it and tilt it so it reduced some of the irritation to that patella or the kneecap. The other type of tape is an assistive tape, such as a rock tape. We use rock tape here in the clinic. It's a kinesio tape. And this is great for just helping with pain management, particularly. So if it's starting to get achy after practice or before bed, it's perfect for that. Perfect. But the key is we got to identify why it's happening. And there's a couple reasons why people can get patellofemoral pain. One is foot pronation. So if you have flat feet, if you have a foot that collapses pretty easily, you're not wearing supportive shoes or a proper shoe that has good foot support in the arch, then you can develop that knee pain. It's a direct link between the foot as it flattens out inward. It turns your knee inward, and what you get is irritation. Now you're getting rubbing on that kneecap on surfaces it shouldn't, on the undersurface and areas that it shouldn't. So you're going to get irritation. Why does it come about with running? Because now you're really generating force to it. Your running is controlled jumping in a way, controlled falling. So you're getting a lot of forces that are going thud, thud, thud onto a surface, such as a court, that doesn't always absorb well. So adding something like a foot insert can certainly help. But the other area that you should looking into is the hip. The hip muscles help control that motion of the knee going inward as well. And that is a critical component. If you have weakness to the hip abductors, the gluteals, the external rotators such as the piriformis, these muscles help control the hip from collapsing the knee inward. It truly comes from the hip. So if we have poor performing hip muscles, either through endurance issues or weakness, that can lead to it. That can lead to the knee constantly collapsing in with running, increased forces, and then you start getting patellofemoral pain. So all in all, patellofemoral pain can be a challenge. It can be a challenge because we don't always want to decrease our activity. We don't want to stop doing the stuff we enjoy, from running, cutting, jumping, or whatever. So the key for us is, one, as soon as you start to feel it, limit your activity. If it's from a weight-bearing running activity, get better shoes. Shoes that have support to them, such as a New Balance, Brooks, ASIC, that has a good supportive inner side of the shoe. Where the arch is, it should be pretty firm right there. If you could take your shoe and wring it all the way around like a dish rag, it's not supportive. You shouldn't be able to wring it all the way around. The other thing you could do is just to help with pain is, like I said, the taping. But the critical component is having a professional look at your biomechanics to see if there's a hip weakness issue, if there's a foot issue, because anything that's below the knee or above the knee can affect that knee pain. And I'll give you one last example, your core strength. Core strength has also been shown to be a factor in patellofemoral pain. So if your core is not fully firing or functioning the way that it needs to, that can also be a factor. And you know what the true reality is? It's usually multiple factors. It's usually not just the foot or just the hip. It's usually multiple factors, all the way down to you can have restricted muscles. The quadricep or the hamstring could be restricted. The calf muscles could be restricted. And these all change the mechanics at the knee. So all in all, for the patellofemoral pain, please know, identify it. Pain that's around the kneecap, especially with the running, jumping, cutting, that's your first sign. The other sign that you need to do is decrease your activity and start icing right away and possibly apply some taping. If it lasts longer than 2 weeks, that's your sign. Pain lasting longer than 2 weeks, have somebody look at it. Have someone like us just pop in. We do 5 times a month. We do a free discovery visit. It's a no cost, no hassle, no insurance needed, no referral needed. You just come in and we tell you whether or not we can help you and what we think it is. There's no obligation after that. It's just there for your benefit to give you the best choice in your healthcare on where to go. So all in all, that's patellofemoral pain. If you have any questions leading up to that, definitely fire away. I got my email at the bottom of this podcast. I have different links that you can connect onto, and then you could always go to our website at Sumner PT for physicaltherapy.com. So sumnerpt.com. All right, let's wrap up the show today. We touched on MRIs. We touched on patellofemoral pain, but where I really want to kind of circle the wagon per se on this is talking about coaching. You know, I touched on it before, how much I love coaching, and part of it is the impact that we make on young individuals. And I'm going to dovetail this into what I told our team yesterday at the end of practice. I watched, while the outfielders were doing specific drills, I watched one of the girls run back, catch a ball, and everybody cheered for her. Yeah, you did it, and cheered for her and just showed her great support. And right after that, it inspired me. It pumped me up. And I pulled him aside and I said, you know what? The reality in life is anytime that we do something new, our first initial response is, do people like me do this? People like me. You go into a restaurant by yourself to get a bite to eat, and you start looking around, do people like me go here? You walk in and there's nothing but bikers and leather and big beards and burliness, and you might be thinking, ooh, I feel out of its place. I don't know, people like me go here. And as soon as you open the door, the music stops and they all turn and look at you. Oh, I forgot my keys in my car, or I forgot my wallet, and you leave. You know, we do that all the time. We start a new job. We're wondering, ooh, do I wear the right clothing? Do I wear what other people wear there? Do people like me go here? Do I fit in? So here's the thing. And this is where I told my team yesterday. If you're a person that's played for our team, this is your 4th year, you're a senior. you're pretty comfortable. You're pretty comfortable. You know what to expect. You know what you're getting out of this. There's not a lot of discomfort for you. There's not a lot of, do I go here? You know you do. You know you do. That's why you keep coming back. So your point right now, and what we're talking about is leadership. Leadership is how we connect everybody together. And one of the best ways that we can do that is we can give people assurance that people like them are on this team. People like them belong here. And we could do that through our words. We could do that through our actions. We could do that the way that we support people, that we give them acknowledgement, praise, shout outs. It matters. That's what leadership is. People want to feel valued. They want to feel valued. And when they stop feeling valued, they look for other things to do. So when we're truly looking at leadership, we need to make sure that we're showing people that they belong here. We need to show them that they're valued. Oftentimes, people will remember how they felt more than the actual experience. When they look back and say this was a positive experience, they're really remembering how they felt. Your emotions are so powerful that sometimes it reshapes your reality. Think back when you were a kid and you're thinking about some of the positive experiences you had. And you have put it into your mind how much you enjoyed that time. And then you talk to a parent about it when you're older and they go, that's not what happened. You were never there. You never did this. But in your mind, it's so clear because you have created it from the feeling that you had. You're remembering how you felt valued, how you belonged, the comments, the compliments people gave you. You're remembering how it made you feel. That is more powerful than any type of achievement that you have on the softball field or at work or other. How you feel matters. So for leadership, to our players, our seniors, future leaders, coaches, it's about how your players feel. Do they feel valued? Do they feel supported? Do they feel that people like them belong here? All right, team. All in all, thanks for listening today. Another In the Clinic with Rob podcast. Really appreciate your insight. I appreciate you reaching out to me through email, through the office, through social media, and giving comments on the content that we're producing, some of the areas that we've been hitting, like today going over MRIs and patellofemoral pain. If you have questions on those, always fire away. Always fire away. And again, I appreciate you listening. I appreciate your feedback. You are absolutely the best part of our show. And I thank you for being a part of that. Until we meet again. Keep moving, team.